Hello, this is Dr. Tom Lewis with Real Health Clinics, and I'd like to talk to you about, is infection the root cause of Alzheimer's disease? And just to give you a prelude, the answer is no. Infection is not at the true root of Alzheimer's disease, but it plays a very significant role, and we'll find out why. So in summary from a couple of the past talks, Alzheimer's is a vascular disease. Heart disease is a disease of the small vessels, of the large vessels, so it's a disease of the small capillaries. Alzheimer's is also a disease of the capillaries of the brain. There's a connection between the two. Both diseases involve inflammation. We can detect inflammation in the peripheral blood in patients with either of these diseases or both of these diseases at the same time. And infection is intimately connected to inflammation. Chlamydia pneumoniae, not the STD, but the respiratory pathogen, and spirochetes, like the bug responsible for Lyme disease, is found prevalently in both these diseases. So let's look at the inflammation ABCs. We need to know inflammation well because a lot of pundits, and they're substantially correct, say that inflammation is at or near the root of almost all the diseases of aging, like diabetes and MS and Alzheimer's and cardiovascular diseases. So we can understand this if we view inflammation very simply. It's a response of our immune system, and our immune system is like a muscle. So you take Arnold Schwarzenegger curling a small weight. He can do this on and on and on. The analogy to our immune system is if we have a strong immune system like Arnold's bicep, we're holding all kinds of disease at bay, and we're hardly working. Our immune system's hardly working. We don't see much inflammation in our bodies. So we're more resistant to disease. Whereas if we're the 98-pound weakling, our muscle soon goes into tremor. We're susceptible to disease. We get disease, and we see high levels of inflammation in our body. Not to say that the strong immune system cannot also see high levels of inflammation. In fact, it can. If we have a very virulent or strong insult or disease situation, then certainly we'll see disease even with a strong immune system, and we'll see inflammation. So the best way to understand where we are in terms of our immune system is to look at death rates from influenza. And what it shows us is that at birth and through the first few years of life, our immune system is slowly developing and adapting and getting stronger and stronger. Then through our teens and into our 50s, we have very strong immunity. And then we slowly start losing our immunity as we age. And when we pass, our immune system goes essentially to ground zero. But along the way, it's slowly decreasing. That's why diseases like Alzheimer's and a lot of these other chronic inflammatory diseases are most prevalent in an aging population as our immune system slowly decays with age. So let's look at some infection facts. So in Alzheimer's, if I say chlamydia pneumoniae is tied to Alzheimer's, did we get the bug yesterday and today we start developing memory problems? Not at all. A lot of these bugs are here in our bodies for a long time. In fact, they're here to stay. Chlamydia pneumoniae, in 20-year-olds, 50% of them that are tested have the bug. So worldwide, 50% of the people are infected with this bug. H. pylori, very similar statistic. H. pylori is responsible for stomach ulcers, and it's a class 1 stomach carcinogen. But we're now seeing in the literature that H. pylori can also be good. How can we explain this conundrum that a bacteria like H. pylori can be both bad and good? I think it's very simple if we extend this into toxicology. If you don't have enough oxygen, it's detrimental to your health. If you have too much oxygen, it can be detrimental to your health. So just like with oxygen and substances like zinc, we need a little bit, too much is toxic. H. pylori, there's probably a sweet spot for it where it's not harmful, but if we become weakened, it can proliferate and we can have too much of it and can be harmful. Toxoplasmosis, not a lot of people have heard about this, but it causes schizophrenia, suicidal thoughts, violent behavior. It's considered the #1 underdiagnosed disease in America, according to the CDC. But the CDC also says of the 60 million people who are infected, very few have symptoms because why? They have strong immunity. These dormant viruses Epstein-Barr and herpes zoster. If you're 40 years old and you're getting cold sores or shingles, that's telling us your immunity is not what it could be. You shouldn't be having these diseases at that age. They should be dormant. Your immune system should be holding them underwater. And then tuberculosis is one of the most studied of these bacteria or these pathogens, where a third of the world is infected, but less than 0.5% have any kind of real or express symptoms, have any kind of real symptoms from that exposure. And my favorite, we had some time ago the Ebola scare, where a Liberian citizen came to the United States. He had Ebola. He infected a nurse. He died. The nurse didn't. Why? Because of her immune system. So we need to be looking at why people survive these diseases rather than why they die. And we thought this was going to be a world pandemic. If you look at the country of Liberia today, there have been many deaths, sadly, from Ebola. But the country goes on and people are living well in Liberia. Next slide. So really, this is what you have to put your mind on in terms of what is the fundamental cause of Alzheimer's. And in fact, all these diseases of aging, most of them tie back to infection. Most of the infections are in our body to start with. We got infected at some point in our life, but they didn't express for a long, long time, and they didn't express until our immune system allowed them to express and start causing disease. So how does infection damage our body? So there's all kinds of theories out there about vascular disease and now Alzheimer's, about your coronary calcium score and calcification of vessels. There's the calcium hypothesis of dementia. We have cholesterol. We have inflammation. So what is it all really about? Well, actually, it's all about immunity, but it's all about these opportunistic pathogens. So infection causes release of calcium. It helps us explain why we have calcium build up in our vessels. Infection triggers nuclear factor kappa beta, which is a major inflammatory response by our body. Cholesterol responds to the insult. In the original study on cholesterol, 50-year-old men with very high 350 level cholesterol, they all had severe cardiovascular disease, most likely tied back to infection. And cholesterol was actually there as part of our immune response. LDL carries the cholesterol to the point of insult, to the point of disease in the vessel, releases the cholesterol, and cholesterol is acting as a part of our immune system. Not primary, probably not secondary, but maybe tertiary, and it's helping our cause. It's working on our behalf. The constellation of these factors leads to hypoxia in our vessels, which is lack of blood supply in the vessels, which leads to tissue death. So this is the fundamental unifying connection between infection and all these things we've heard about when it comes to like Alzheimer's, vascular diseases. So the true root cause of AD, it's not infection. It's the immune system and its weakness thereof that leads to the susceptibility for opportunistic organisms. And yes, as the infection proliferates, it certainly exacerbates the disease. But it's completely within your control to upregulate, govern, or improve or maintain very strong immunity to keep these organisms that are opportunistic from ever expressing in our bodies. So in our book, The End of Alzheimer's, Chapter 10, we go into great detail about what you personally can do to bolster and improve your immune system health to prevent you from ever getting Alzheimer's. And by the way, since Alzheimer's is a vascular disease, it'll certainly help you with all the vascular diseases if you're diabetic to ensure a longevity that you're not going to be dying from vascular diseases as well. So Chapter 10 is the chapter you want to read. So in conclusion, Alzheimer's is a vascular disease. Vascular diseases are caused by infection that triggers inflammation, but proper immune health keeps pathogens in check, keeps inflammation down, keeps calcification from your vessels, keeps your cholesterol levels naturally down because it doesn't have to elevate to protect us against this constellation of diseases that stems from poor immunity and infection. My name is Dr. Tom Lewis with Real Health Clinics, and I appreciate your time. Thank you very much.